Hi, I'm Dr. Jeanine Downie from Image Dermatology in Montclair, New Jersey. I started my practice 21 years ago, and the vision of my practice was to create a space and a safe place for people to come and talk about their image. People wanted to be worried about their acne, be worried about their eczema, be worried about their frown lines, their skin complexion, their skin sagging, creasing of their neck, creasing of their chest, body fat, so all of that. So image dermatology, so really going over the patient's entire self-image. And that's really what I wanted to do, was to create a space where men and women alike, Black, white, Latino, Asian, Native American, could all come to see me to talk about their image. In terms of an introduction to the team, I practice with, it's myself, the MD, who's the Director of Image Dermatology in Montclair, New Jersey, since January 2000, and Megan Kara, who is a physician assistant. Megan has been with me for 5 years now, and she is board certified like I am and trained extensively in the field of dermatology. I have a office manager / study coordinator, because we do a lot of clinical trials here. And then I have a team of mostly women helping pick up the phones, get you your appointments, get you your products, get you your prescriptions, and get you set. I do mostly cosmetic dermatology, about 80%, and I do about 20% general dermatology, or medical dermatology, as it were. I practice with one physician assistant. We do a lot of skin cancer surgeries in here, and we help people to determine what putting their best foot forward is. So in terms of some of the special equipment I use that differs from other doctors in my area, being an African-American female, I wanted lasers that were safe and good for my skin type. And I also want to be able to use them for everybody. So therefore, I have lasers that are colorblind in my practice. And when you come in, I evaluate you, I decide what lasers to use. I have laser hair removal for all skin types in here. I have broken blood vessel removal for all skin types in here. I have keloid reduction and scar reduction for all skin types in here. So for example, I use the XLV many times for my browner skin patients for laser hair removal. I use the Gentle Lace for lighter skin patients. I do a lot of injectables in my practice. So I do a lot of Kybella. I do what I call Bouncy Botox. You see how I can frown and I can raise my eyebrows and I don't look stilted at all, but you see no lines there. So somebody that's my level of expertise and my level of maturity and my age, typically without Botox, might really have some lines here now. So I make you look natural, but I make it so that you can still move. So what people need to do as patients is look in the mirror and figure out what you don't like. Is it that line right here? Is it that wrinkle right here? Do you feel like you need to be picked up a little? So what you're looking at and seeing in the mirror is what people are seeing on Zoom calls and what people are seeing in person. So just little tweaks can help so very much, as everybody knows. So figure out what it is that you want to do, and then call and book an appointment and let me take a look at you, and let's agree to make your skin tone more even, your pore size smaller. Let's lift up your eyebrow a little bit. Let's lift up your face a little bit. Let's do a little bit of lip filler like I have, but not so much that you look not good. Let's try to take out some of the lines in your neck, lines from your chest. Let's decrease inches from your waist. We can do it all together. So come on in.